go into a little bit more detail about the efficacy of the vaccine for your patients who are on different disease-modifying therapies then. So can you comment a little bit on what we know about the DMTs and the vaccines?
So I think we have to be really honest with the MS community and say, we're still learning. We've learned, we know a lot more now than we did a year ago, and we will know more a year from now than we know right now. And so we're learning that, that certain of our disease modifying therapies could potentially affect the efficacy of the vaccine, but we don't know that for sure, because we don't know that the tests that we're using to measure, say, antibody responses are really measuring the right thing as it relates to vaccination. The FDA just late last week, came out with another guideline statement saying, guys, don't use the COVID antibody test to determine the efficacy of the vaccines. It's measuring a different antibody. So the antibodies that are produced from COVID vaccination are specific to the spike protein. That's not completely what the antibody test is measuring. So the FDA has they've told us before, we just are not listening very well. And so they've told us again, don't do that. So, and that's true for all of us. And now when we get into the specifics of MS and MS therapies, it gets a little trickier. And now we have to think about T-cell immunity, the whole other part of our immune system. We now have a test that measures the T-cell response to COVID, but it's not widely available, at least yet. So I know we're not using it in our particular clinic. So yeah, it's a very nuanced discussion. And I think one we need to be honest about and saying that we're still learning.
So people have been hearing, maybe it's scuttlebutt, maybe it's data, but about the B-cell therapy, disease-modifying therapies, and also fingolimod. So given what you've just said, this news from the last week about how you would test a person's response, what do we think might be true of any differences between people on those disease-modifying therapies and other therapies? Is there any difference?
I think there is the potential that people on B-cell therapies and fingolimod and the other S1P modulators could have less of an immune response to COVID vaccines, or maybe to any vaccine, and maybe we should act accordingly. I still don't know that we have hard data necessarily to back that up. There was the paper that was presented at the last Academy of Neurology meeting, not related to vaccines, but at least looking at people who had had real COVID infections. And what they found with real COVID infection is that people on B-cell therapies did seem to make less of an antibody response to the natural infection, but they still made a really good T-cell response to the natural infection. We hope that applies to the vaccine also, that maybe people on B-cell therapies don't make as good of a B-cell response or antibody response, but maybe they still make a really good T-cell response. And maybe that's going to be enough to protect them in the long run.
So let's assume that not everybody knows about their T cells and their B cells and what that means. So, Megan, if one of your patients was on a B cell therapy or on fingolimod, and that person says to you, well, I've heard that the response to the vaccine may not be so good, so why should I bother getting vaccinated? What would you say?
I think it's that an attenuated response is better than no response. And because we're still continuing to practice these other measures with masking and social distancing, which do work, we know those things work because of the past year, that person could be fairly well protected if they received the vaccine. There's also timing of vaccines, which with the B-cell therapies, we talk a lot about what's the timing, but the fact is most of these folks, unless they're really early on in treatment, they're chronically B-cell suppressed. So the timing isn't, I think we talked about this when we last got together on Zoom. The timing isn't as important as we initially thought. But if a person is new to therapy, new to a B-cell therapy, or maybe to an S1P, if they can complete their vaccination safely before starting that therapy, that might be a good way to go. But in general, it's, some is better than none. That's how I look at it.
So then if one of your patients, Megan, said, well, I'm on a B cell therapy or I'm on fingolimod and I'm wondering if I should switch because I want to get the best COVID response from my vaccine that I can possibly get. Should I switch?
Yeah, so I would actually say, well, let's talk about the best response for your MS that we can possibly get first before we talked about switching drugs because of a vaccine response.
Okay. So I see you nodding, Ben, and I assume that your answer would be the same to a patient in your practice.
Absolutely. And so I think, when we think about risk benefit ratios, there's risk in switching MS therapies. You could potentially move to a therapy that's not as effective for you, or maybe it has side effects that you didn't see with your existing therapy. So I totally agree with Megan on, let's focus on your MS. We know that there is benefit from vaccination, even if it's a slightly attenuated, response. So totally agree.
So the psychologist in me is now wondering about how we're going to manage life as the world around us starts to open up and change. And we talked at the beginning, we're still carrying our masks around, we're still wearing them under some circumstances because that's how we feel most comfortable or most respectful. But what if somebody says, why are you wearing a mask now? You don't need to be wearing a mask anymore. What's the matter with you? So I'm going to answer the question first, but then I would really like your thoughts about this. And my thought is that, first of all, it's nobody else's business what we do, but that may not be the best answer to give. And so I think, as with many other awkward questions that people with MS sometimes get, why are you walking with a cane? Or what's the matter with you? Or people need to come up with their own script. We all do. We need to say whatever we feel comfortable saying in response to a question that we either don't like or we think is inappropriate or we think is not somebody else's business. So for me, if somebody around me looked at me kind of weirdly and said, why are you wearing a mask? It's not required now. I would say, because I'm more comfortable wearing a mask in certain circumstances. I'm vaccinated, but this is how I'm comfortable. So that's the way it is. Depending on who the person was who asked, a complete stranger, that's probably all I would say. But I think for a friend or a family member who said, hey, restrictions are being lifted, why are you wearing a mask? I think my answer is a little more complicated. I think it is how I feel safer and best. I think it's like what you both said earlier about setting an example for safety and comfort in certain circumstances. So certainly if I enter an establishment that has a sign up saying, please wear a mask, I'm going to wear a mask because that's what they've asked me to do, and I want to respect their wishes. I'm also very sensitive to the fact that some people still feel quite vulnerable. They haven't been able to get vaccinated yet, or they're not totally vaccinated, or they have other health conditions that make them vulnerable. And I want to make sure I'm being respectful of their safety, because I can't assume that everybody's as protected as I am. So those would be all my reasons. Do you, either one of you, have any other reasons or scripting that you could give people to help them answer that question?
I feel the same way, Roz. I actually, in my practice, as you told the story earlier, Ben, I take care of a lot of vaccine injured people. So people who actually have had very severe adverse reactions and should not get the vaccine or other vaccines for that matter. And I feel like I'm healthy and wearing a mask. It doesn't cause me anxiety. And so if donning a mask means that I make someone feel a little bit more comfortable in a crowded public space, then I'm totally willing to do that. Because I imagine people that want to get vaccinated that can't also have a lot of anxiety. And so, you know, I approach things the same way that you do.
I totally agree with both of you. To me, it's just baffling that people would have the nerve actually to go up to a stranger and question them on something. If someone's doing something that encroaches upon your personal space or your health, I think, yeah, then you're okay. But my wearing a mask doesn't hurt anybody else. No, that person wearing a mask doesn't hurt me. It's just amazing to me that we can't be nice to each other and just say, I'm not going to make assumptions about what's going on in your life. You know, my wife and I, when we see someone, you know, do something that we might think is a little rude in traffic, maybe they're cutting people off, we always don't blow the horn. What if their kid is sick at school and they're going to pick them up? What if they have someone who's got, you know, an emergency at the hospital? Just if we would just, I think, be nice human beings and cut each other a little slack and say, you know what, it's not hurting me at all. Just I don't have any right to question why that person is doing what they're doing with wearing a mask or yeah, anything else. That social distancing, it doesn't hurt anybody.
I have one last question, just for clarification. You've both talked about very severe vaccine responses, and I just want to clarify for our listeners what you mean, because all of us have heard one or another person say, oh, I had a really bad reaction to my second dose of this or that. You know, I felt really crummy. I had a fever and a flu. But you're talking about something different. When you talk about a very severe reaction to a vaccine in the past, could you describe what you mean so we don't confuse anybody?
That's a great clarification. So I mean something like an allergic reaction, shortness of breath, hives. So everyone with, or I shouldn't say everyone, most people with second dose of COVID, a lot of people with a Shingrix vaccine or a, you know, HPV vaccine, they're going to feel achy. They're going to feel a little bit under the weather. That's normal. That's to be expected. You might have soreness at the injection site. That's normal. We're talking about anaphylactic or severe allergic type reactions to a vaccine.
Okay. So if anybody has had that kind of very severe reaction, they might not be able to take any vaccine. I guess that's why when I get my flu vaccine every year, one of the things you have to sign off on the permission slip is if you've ever had a very severe reaction in the past. So thank you for that clarification. So I want to thank you both again. I'm assuming that we will have probably a third installment on COVID as our COVID world evolves even further. But thank you for doing this again. I hope all of this information helps answer the questions that people are asking today. Thanks very much.